So a lot of students have cleared FMG examinations, so there must be a lot of success stories and interesting stories behind that. So could you just share a few of them with us?
I remember there are some students from terrorist infested areas who joined us.
Okay.
They sold their land to join us. So they came and joined LAU, and I was the happiest man when that particular student cleared his FMG in first attempt, got his internship in first attempt, and got his provisional registration without any complication. This is a success story. My students have not only qualified FMG, let me tell you very clearly. 85% of the students have qualified the USMLE. Rather, some of my students are still to appear for my exit examination of the university, but they have qualified USMLE Step 2. I have got 100% students qualifying PLAB. 100%. PLAB is the Professional Linguistic Assessment Board examination conducted by the General Medical Council of UK. 100% who appeared have qualified that examination. All students who appear for the Caribbean Medical Council examination qualified.
Hello everyone, I am Vani Agarwal this side, and today we welcome Vice Chancellor of Lincoln American University, Air Marshal Dr. Pawan Kapoor, who will be enlightening us with FMG and exceptional performance of LAU students in FMG examination. So, we welcome you, sir.
Thank you, Vani. Thank you for having me on this show, and I bring greetings to all of you and to all my viewers from Lincoln American University and from all the staff and faculty of this newly formed university, but growing and developing very well in the last 7 to 8 years.
So, I just want to know that, could you explain FMG examination for the students who don't know about it?
Okay, the FMG examination actually called Foreign Medical Graduate Examination. It is conducted by the National Board of Medical Education and Medical Sciences. Now, this examination is basically a licensing examination for students who have acquired their qualification from foreign medical institutions. And for these examinations, basically students have to do nothing more but prepare as per whatever is then taught to them in their curriculum. This examination held twice in a year. This examination has only one paper but divided into two parts.
Okay.
Each part is of 150 marks. So one part is held in the morning and second part is held in the evening. It is essential for all the students to get at least 150 marks out of the 300 marks to qualify in this examination. All you need is qualifying marks of 150 out of 300, that is 50% marks. Now this examination, actually it has been made a, sort of a something very big or something very huge. It's not that big, it's not that huge. It is simply trying to assess your competencies and your skills for your ability to practice medicine as a simple physician in this country. Every country has an examination, qualifying examination for licensing other practitioners. We also have got this examination. There's nothing great about it. Yes, you have to prepare for it. And it is conducted on behalf of the National Medical Commission. You have got almost 20 subjects which you have to prepare, which have been taught to you in your MBBS curriculum. Normally they are like anatomy, physiology, biochemistry, forensic medicine, pathology, microbiology. There are 7 subjects which are taught as preclinical and paraclinical sciences. They contain about 100 questions from this particular pre and paraclinical sciences. Then there are 200 questions from clinical sciences, and clinical sciences contain medicine and allied subjects, general surgery and allied subjects. It also contains pediatrics, obstetrics and gynecology, ENT, IA, community medicine and pediatrics. So this is how the examination is conducted. Of late, this is for the students who are going to appear now. They must be aware of late, FMG has introduced a section-wise examination. In which case, say the first part is divided into 3 sections of 50 questions each. Till the time you do not finish the first 50 questions, you cannot go to the next 50 questions. And once you have finished, and when the timer starts, only then you get access to the next 50 questions. Of course, it's a computer-based examination. So you do not get access till the time you don't are time for that question.
Okay.
You are also given a chance to review your questions. So once you review a question, it has to be within that time frame of that first section. This is a recently introduced concept. Maybe it is something like what USMLE does. So it's going through that pattern. But this is what foreign medical graduate examination is all about. Students who study should not fear this examination.
Definitely. So this is a really like update news for us, like because most of students won't be knowing about the update in FMG examination. You mentioned the stepwise upgradation, and I also want to know that the students who are appearing for their graduation in abroad would be giving the examination, or those who have completed their graduation in India, they have to also give the examination.
That's an interesting question. See, at present, only those students who are qualifying MBBS and equivalent examination in countries abroad are required to get this foreign medical graduate examination. But as per the NMC Act, there is an examination called National Exit Test, which they are supposed to bring into play in the years to come. Most likely it will going to be 2028. When National Exit Examination happens, which means, let me clarify, all students who are going to go abroad now, probably when they come back, they'll be appearing for the National Exit Test. And this National Exit Test is common to both Indian as well as those who qualify from foreign medical institutions. All those graduates will be appearing for this common examination. So there will be no difference between whether you do your MBBS from abroad or do MBBS from India. Normally what has been proposed is that this examination will be in lieu of the final MBBS examination in India.
Okay.
So it will be held for a longer duration. We do not know exactly what shape it is going to take, but what we hear is that it will be held over a period of 3 days. On the first day you will have in the morning session about medicine. In the afternoon session you will have pediatrics. Again, second day morning session you will have surgery. In the evening session you will have, say, ENT. On a third day you will have obstetrics and gynecology in the morning, and you will have your eye in the evening. So this is what is proposed. What comes out, the future will tell us.
Okay, thank you so much for the information. And as we know that Margate is buzzed by the result of LAU students in recent examination of FMGE. So how does you feel about that?
Okay. In one word, I feel proud.
We all
Happy.
do.
And I feel proud because this was my first batch, and actually I was surprised because we put a lot of efforts in this batch, and we thought God knows how the results are going to be, but in the last 1 year they have surprised me, and our results are excellent. We have almost 75 to 80% people passing, students passing this examination, and it is a testimony to their hard work. It is also a testimony to the hard work put in by the teachers, and also the blessing of the parents, and of course slightly bit of luck which comes from the blessings of the Lord Almighty. So yes, I am happy and proud about this.
Thank you so much, sir. And we all are proud of it and the work team has put into an LAU university. So could you also brief or give us information about the role LAU plays in enlightening and helping out students with FMG examination?
Okay, see, LAU gives them a platform. It gives them a platform for academic excellence. See, you can, we have a common saying that you can take a horse to the well, but you can't make him drink. LAU provides that platform where you provide you all the facilities, all the resources, all the academic resources that are required for a student to excel in the examination. It is up to the student to avail or not to avail. Yes, what we try to ensure that we also make the horse drink the water. Okay. So what we do, we tell them that, see, this is your career, your future. You have come here with an aim in mind. We are going to provide you with all facilities to make you excel. But finally, you are the person who is going to excel. So you have to be very, very clear in your mind why you have come to LAU. So we set the tone right from day one when the student comes. We are very strict in our discipline. We are very strict with our academics. We are very strict with our attendances. We provide a lot of facilities to them. But finally, the student had to avail those facilities. So yes, LAU gives them the platform from which they can take off, and if they don't work hard, there are some students who have not qualified, and I know why they have not qualified. Because from day one, they were not focused on their studies. So my advice to all my students is, when you come here, you catch us if we don't provide you with the facilities. But once we provide you with the facilities, please make use of those facilities. I am very happy that my majority of my students have availed the facilities, and the results are there for everyone to see.
Yes. And because it is very tough for us to manage Indian students or any abroad student to adjust in new environment in a foreign country, and everyone
Let me tell you one thing. Let me interrupt. Sorry to interrupt
no.
you. It is not tough to manage the students. It is tougher to manage their parents.
Yeah, that is
Because
a
they are
point.
equally, they have invested money.
Sure.
Their child is staying far away from them. They are not aware of what is happening there. तो अगर बच्चा जरा सी आह भी बोलता है ना, तो वो सीधे यूनिवर्सिटी के वाइस चांसलर से क्वेश्चन पूछते हैं. So
बिल्कुल.
we are more ahead of the parents, but yes, we have also had the complete support of parents. When their child is not developing as per our requirement, we also have direct access to the parents. So we tell them, please try to tighten the screws on your wards before they get out of hand. So yes, it is a three-way system where the students, the parents and the faculty interact together for the betterment of the students.
Because it's very tough to manage the discipline in students when they are in abroad, because for reasons only.
Yeah, it is tough anywhere. It is tough in India, it is tough outside, it is tough everywhere. Because बच्चे हैं, mind चंचल होता है. It can go anywhere. We have to bring them to path every now and then. So at times we have to be harsh. But it's all a part of the game. And the end of the game is whether you win or you lose. Clearly our first batch has won.
That is very nice for us, sir. So a lot of students have cleared FMG examinations, so there must be a lot of success stories and interesting stories behind that. So could you just share a few of them with us?
Each student is a success story for me. Whosoever passes this examination and comes out in flying colors is a success story. But some people who touch you,
Yes,
who touch
there
your
are.
lives. Some students touch you, they touch your lives. I remember there are some students from terrorist infested areas who joined us.
Okay.
They sold their land to join us. Okay. They wanted to get out of that environment because they wanted to be a very productive part of their own country. They viewed India as their country.
Yeah.
But they were in an area which was infested with terrorists, and they wanted to just get out of that system.
Have a secure future.
So they were scared.
Secure.
So they came and joined LAU, and I was the happiest man when that particular student cleared his FMG in first attempt, got his internship in first attempt, and got his provisional registration without any complication from the state in which he joined his internship. This is a success story. Somebody coming from a low socioeconomic status, somebody who is coming from a status from a state, and from that part of the state which is infested by terrorists, or which is which has borne the brunt of the terrorists, coming from there and excelling in academics. I think that's a success story. I have another student coming from a rural area who didn't know how to speak in English. So we had to actually first make him learn how to communicate in English. And he was success for us. Everything in first attempt. So, I don't know, there are girls who came totally, I am from this state, I will not talk to that boy of that state.
Yeah, there are students
Gradually,
like that.
they mixed around, not even boy of another state, they mixed around with boys and girls of other countries.
Yeah.
There was a totally personality change and transformation. These are my success stories.
The acceptance.
They are no longer physicians who are only going to look at people in one particular state or one particular country. They are physicians who can work across the globe anywhere, because now they can mix and mingle with different cultures. So I think there's so many success stories.
Because you mentioned the one with the terrorist background, a country. or area. So it is not for him like he's starting or she's starting from scratch. It is like they have to come at a normal pace and then they have to start from scratch. It is like 300% work for them, and they have succeeded that. So this is really something we can be inspired of.
Yeah, I think this is a story of inspiration with children from low socio-economic strata, children who did not know how to mix from people of other state who only talk in their own local language of their state. Today they are talking foreign languages.
Yes.
So you can imagine the cultural changes and how confident they become at the end of it.
And you being from the army background, you know how tough wars can be on students and how tough violence can be against person's personality. So they being accept the secure environment and willing to perform is really nice that LU has done for them.
And my students are good. They made the environment secure themselves.
Definitely. So it is really nice to have being learned and inspired from. There are like students have cleared their FMG examinations, and so is LAU tied up or have collaborations with Indian institutes which help them to get their future bright in.
Yeah, see, we have collaboration with Max Healthcare. We also collaboration with US. We have collaboration with Nepal. These collaborations provide them opportunities for doing clinical rotations and developing their clinical skills. So, our collaboration with Max, unfortunately, currently, because of the changes in the rules of National Medical Commission, as per the new Gazette notification, we have to now complete everything from Guyana itself. So, what we have done is we have continued a relationship.
Okay.
Our students, when they come on vacations, they undergo observership here in various clinical specialities so that they understand the clinical profile of patients who come in India. They understand the healthcare delivery system of India. They understand the genetic makeup of India and the way the Indian families respond to the questions and how they respond to treatment. So, to make them aware of this, we have a tie-up with Max. This tie-up is important.
Yes.
Why this tie-up is important? Because this tie-up exposes them to how a particular disease is tackled in India.
Because practical knowledge is like we'll be getting theory information, we can read, okay, if I get a stitch, I'll be getting help, I'll be doing needling and everything. I'm sorry if I don't know the medical terms.
It's called suturing. You see, what happens is that if you come to a country where you're going to appear for their examination, it is better to get acquainted with their disease pattern,
Yes.
their various standard treatment protocols, so that when the question comes on the examination, you do not feel uncomfortable about it.
Yes.
I'll give a very simple example. Let's say I'm a student who is studying in a foreign country where anybody presenting you with a pain in the right side of the abdomen, most likely it is a case of cancer. But when you come to India, cancer is the last diagnosis. We first think of amoebiasis.
Gastric, it could be
We
gastric.
feel maybe it is most likely amoebiasis. We try to treat him from amoebiasis, we try to treat him for ehrlichiasis, for other diseases, rather than jumping straight to cancer and other chronic diseases. But in some countries, that is the mode of presentation. So imagine if the student is studying in that country and comes to India, he will give the cancer as the first diagnosis. Where in India, the answer is the first diagnosis will be amoebiasis.
Yeah.
So this is how you are tested.
Yeah.
And this is how they don't fail the examination because they don't have the knowledge. They fail the examination because that knowledge which they acquire is no longer relevant to Indian setup, Indian surroundings. That is why they don't do well. So once you catch this mantra, you pass your examination.
That is very nice intake. And this leads to our next question, that what is the LAU's curriculum which helps students to clear their FMG examination?
You know, Vani, I hear about this curriculum.
Yeah.
I don't understand one thing. Why we keep talking about curriculum? It's that this continuously Indian curriculum, US-based curriculum, European curriculum. Our body is the same.
Yeah, it
The
is.
anatomy, the structure of my body will not change whether I am studying in USA or in Guyana or
Definitely.
in Russia or in India. The structure remains the same. So I'll study the same body parts. I'll study the same eye, the same nose, the same throat, the same brain, the same abdomen, the same heart.
Yeah.
Everything is same. Anatomy, physiology, biochemistry, forensic medicine, community medicine is same. Curriculum is same. There is no change in curriculum. Whatever National Medical Commission gives, the same curriculum followed by in Guyana. Whatever the US based curriculum is there, it is
Yes.
followed in Guyana.
Okay.
What is different? Two differences.
That is.
One difference is the disease profile.
Okay.
The disease profiles are different in different countries. You know, developing countries have different diseases. The developed countries have got different diseases. India is a developing country going on to become a developed country. So India is having a mixed burden of diseases. India is having communicable diseases on one
Yeah.
side, also India is having non-communicable diseases on the other side. So we have to prepare them accordingly as per the country in which they are going to appear for the qualifying examination. If you got to come to India and appear for FMG, you should be well versed with both communicable and non-communicable diseases. So we
Yes.
teach them those diseases accordingly. Second issue is how you deliver the curriculum.
That is.
Extremely important.
It is.
Now you follow the traditional system as is followed in most of the European countries and in India, or you follow a system-based curriculum which is done in US and certain other South American countries. Well, in Guyana we follow a system-based curriculum, which means that you should get clear concept about a system. Now see what is the drawback of a traditional curriculum. I learned anatomy, physiology, biochemistry in my first year. I learned
Okay.
pathology, microbiology, forensic medicine, everything in second year. Third year I go into clinics. I start seeing patient. I have forgotten my anatomy. I have forgotten my
Yeah.
physiology and biochemistry. Here what we do? No. We will teach you cardiovascular system. How does the cardiovascular system come into being? So we teach you the embryology of cardiovascular system. Then we teach you the gross anatomy of cardiovascular system. Then we teach you the histology of cardiovascular system. Then we teach you the physiology, the functioning of the cardiovascular system. Then we teach you what can go wrong. So what is the pathology of cardiovascular system. Then we teach you what are the drugs that can act on cardiovascular system. So we teach you the pharmacology of cardiovascular system.
Okay.
Then we teach you the practice of medicine.
Yes.
How you identify diseases in a patient. He gets a holistic view of cardiovascular system in which he can relate anatomy, physiology to the disease and to the treatment.
Right.
So you see, this is how you deliver the curriculum, giving a full understanding of that particular system. Then he moves to another system. Then he moves to another system. Yes, we have verticals. Like general pathology is common to all. So we teach general pathology as a vertical. Then we have got, say, general pharmacology common to all. We teach general pharmacology for everybody. Then we have got certain general anatomy, certain terminologies. All these are common. So we teach them in a vertical fashion. Like
Okay.
community medicine, forensic medicine, your behavioral sciences, all these are verticals. And rest are all horizontals. So a student gets a very holistic view. The way we deliver the curriculum, I think it is amazing that Lincoln American University in a short stay of time has managed to put into place a system-based curriculum, and that reflects in our results.
Yeah, that does, and it helps with the specialization as well.
Absolutely, you see, my students have not only qualified FMG, let me
Yeah.
tell you very clearly. 85% of the students have qualified the USMLE. Rather, some of my students are still to appear for my exit examination of the university, but they have qualified USMLE Step 2.
And that
Okay,
is.
I have got 100% students qualifying PLAB. 100% PLAB is the Professional Linguistic Assessment Board examination
Okay.
conducted by the General Medical Council of UK. 100% who appeared have qualified that examination. All students who appear for the Caribbean Medical Council examination qualified. So my results are there for everybody to see, and it is not that I am saying.
Yeah, it
I
is the
say with a lot of
results.
pride because we put in a lot of efforts. But this is the result which we have got after years of hard work not only of the faculty and the university, but also of the students, and direct involvement of parents.
And this is not just learning, it is grabbing knowledge.
Yes, absolutely.
It is
I
about
said,
knowledge.
we provide you platform. You have to take off from that platform.
That is really nice to hear. So, sir, could you also enlighten us about how does clinical rotations from affiliated hospitals help students in strengthening their career in medical field?
See, clinical rotation is translation of your classroom knowledge onto the actual work field. What is the
Okay.
working field of a doctor? Is the
Hospital.
patient, is the wards, is the departments. So a student goes through each and every department to acquire knowledge and competencies and acquire skills. Now what does clinical rotation means? Clinical rotation means rotation of a student in various clinical departments so that he can sharpen and hone up his skills and competencies in history taking, in examining the patient, in interpreting the various diagnostic results, and see how treatment can be instituted based upon analysis of all these three things put together. So our students, when they go to affiliated hospitals, they go through certain core rotations, that is medicine, surgery, obstetrics and gynecology and pediatrics, which are for 12 weeks each. That means a total of 48 weeks of core rotation in these four subjects.
Okay.
In this, he will learn how to take history, he will learn how to do physical examination, he will learn how to order investigations, he will learn how to interpret those investigations in collaboration and in correlation with his clinical findings and history. Then he will come to a provisional diagnosis, and then he can give a provisional treatment.
Okay.
So what he is doing, all his knowledge of anatomy, physiology,
Yes.
pharmacology, pathology, he is now applying it here.
Okay.
So that's an application of the theoretical knowledge to a clinical surrounding. So Vani, you see, clinical rotations helps the students to translate their classroom knowledge onto the patient care activities, and it helps them to build up a holistic concept about patient care.
Okay.
It is a very, very important aspect of their training because this is hands-on training. Presently, this training is done under supervision of
Okay.
experts. Once they pass out, complete their internship, they become independent practicing physicians, and this training gives them the necessary confidence to become independent practitioners.
So it is like the stepwise checkup of a patient, so we don't miss out anything.
Absolutely.
So it is, if anyone is here for a fever or something, so we have to check everything. So there is nothing to be missed out, any
As I said
disease to be
earlier,
missed out.
It starts from the history taking, ends in a provisional diagnosis and a proper plan of care.
Okay.
Okay. But this is skill building, and this comes with years of experience. This is the initiation of the students into getting that experience.
Okay. Thank you, sir. And sir, how we can assure students or parents that Lincoln American University is the best choice for their medical career?
Well, see, I am not here to sell Lincoln American University
Yeah.
because my university is doing well for itself. Our results are there for everyone to see. We all know that we have the best results in entire Caribbean. Rather, if you
Yes.
take it on a global landscape, we are right there on the top.
Definitely,
So our results
sir.
are there to say what we are doing.
Yes.
I need not convince anybody, but for the sake of those who don't have knowledge, who have got so many people visiting them, I will not say Lincoln American University is the best or the only choice you have got. I say it is one of the best choices that you have got. Why? Because number one, we have the best results in foreign medical graduate
Yes.
examination in India. We have one of the best results in USMLE. We have the best results in PLAB. We have the best results in Caribbean Medical Council examination. Our results speak for themselves. Second thing is this, what you're looking for is a university recognized. Definitely when so many students have cleared FMG, it has to
Yes.
be recognized.
Definitely.
When so many students doing internship, it has to be recognized. But for those who still want, we are listed in World Directory of Medical Schools. We are recognized by the National Accreditation Council of Guyana. We are recognized by the Medical Council of Guyana. We are also certified by the Educational Commission for Foreign Medical Graduates in USA. We are also certified by the Medical Council of Canada.
Okay.
We are also listed with the General Medical Council of UK. We follow all the parameters as given in the National Medical Commission Gazette of 18 November 2021. We have association with Association of Medical Education in Europe. We have association with Global Alliance for Medical Education. We get inputs from here to improve our teaching methodologies and to see how the same course can be developed and delivered to the students in a manner in which it becomes more student friendly and they can help us to get better results. We are situated in a place called Georgetown, which is the capital of Guyana. Guyana, as we all know, has got almost 40% Indian population.
Yes.
There is nothing to worry about Indian food. We don't talk about it. क्योंकि गली गली नुक्कड़ नुक्कड़ पे हिंदुस्तानी खाना आपको मिलेगा. तो जो आपकी देसी दिल की रसोई है वो आपको गयाना में नॉर्मली मिलती है.
और अभी पीएम मोदी भी गए थे गुयाना.
Yes, our honorary prime minister also went to Guyana. Rather, as a part of vaccine Maitri,
Yeah.
Our honorable prime minister had given a lot of vaccines to Guyana free of cost during COVID times.
This is really nice for building relationships between
We have
countries.
excellent relationship. Our president of Guyana, Professor Dr. Irfan Ali, he has roots in India.
Yeah.
They all have roots in India, you know. The prime minister, the president, the vice president, name it, all of them, their roots are in India. So basically it's a country which is actually just like India. It's
Yeah.
a mini India in South America. Let
Okay,
us put
sir.
it that way. So there is nothing to worry, dear parents, I assure you. Don't go where it is far. Don't worry बच्चों का क्या होगा, क्योंकि जितना दूर बच्चे आप लोगों से जाएंगे उतने अच्छे नागरिक बन के वापस आएंगे, उतने अच्छे प्रोफेशनल्स बन के आएंगे. LAU आप ऑप्शन ज़रूर रखिए, बिकॉज आवर चिल्ड्रन हैव प्रूवन इन द लास्ट 1.5 years they are better than the best, and that is one sole reason why you should send your students to Lincoln American University.
Okay, thank you so much, sir. Thank you for enlightening us on this great topic, and we wish for the success of LAU in future as well.
It is successful.
It is.
We wish it that it climbs higher and higher.
Definitely.
Okay.
It
And
will.
comes up in the ranking in the world for a university to be reckoned with amongst one of the best.
Definitely. Thank you for watching this video. If we missed out any questions, please drop them down in comment sections and we'll be answering you in the next video. So thank you, sir, for being with us and enlightening us with the FMG examination and all the information you share.
Thank you, Vani. Thank you very much.